My role was accidental in the sense that I was brought in to give a perspective on a ward that had 3 years of traditional management approach to try and change it without any success. So I was brought in to say, to give an opinion and say, what could we try that was different? And my role then was to apply my knowledge and my experience on quality improvement methodology, but actually to enter that ward with a view, in the end, to undo the traditional management thinking and to instill that new approach on improvement in the staff that were doing the work day in, day out. There are a number of key issues that were evidenced how troubled the ward was. There was a high drug error rate, at worst 3 or 4 errors a week. There was a real problem with staff sickness rate, which I think is a measure that indicates lots of other things that weren't working within that facility. And I suppose the other measure was that nobody was doing any improvement work. There weren't any projects focused on how to improve the particular facility and the care on that facility. I actually learned a huge amount from that piece of work myself. There are lots of examples of things that I learned. For example, I could instill or transfer improvement methodology without taking staff out on a day or do any training formal sessions or even use a single slide for training. It's possible to engage staff day to day in their work to undo their thinking and build new thinking. It is just by simply engaging with staff to begin to get them to think differently about their work and then start doing projects for improvement in the shifts that they're working. I learned that you do require leadership that wants this to happen. So the leadership on that ward was desperate to try something different and was prepared to listen and learn, and that made my job a lot easier. I learned that I didn't have to do the work because actually the people that do the work are the ones that can improve the work. What I brought was that I filled that gap, which is they understand the issues that are troubling and they know where they want to get to. The question is, how do they get to that outcome? And if you like, filling that gap was what I delivered for them without spending a penny. This was a ward that went from very troubled and really concerning to the hospital and to the directorate to an exemplar ward in about 9 months. So this ward went from a drug error rate of 3 or 4 per week to 89 days, 113 days. So a huge gap between drug errors, which is a phenomenal achievement. But as a consequence of a number of different projects that we were doing on the ward, which effectively changed the culture as well of the ward. So from 0 projects to about 6 to 8 running at any one time. And quite a striking change in the sickness rate. So at its peak, that ward had a sickness rate which was very high at 15%, but on average around 9 to 10%. By February of this year, or by about 7 or 8 months, in essence it was close to 0%, which I think was a phenomenal change, reflecting the fact that staff now felt happier coming to work because they felt that they were being listened to. People were developing them to do work, not just to do the work, but to improve the work. So for the first thing I'd say is that I find doing this work extremely exciting. Okay, I think you could see it as very difficult because people see change and improvement work potentially very difficult. But actually I think that's part of the fun. I believe that the theory and the knowledge is easy to acquire. I don't think it should cost any money today to acquire that, to be honest, because all the resources are out there, easily available. I think it's good to have access to a mentor who has experience to this particular approach to change, because that'll accelerate your learning phenomenally and allow you to then do the projects. The other key thing, and I think this is absolutely key to the learning, is that theory and knowledge needs to run parallel with projects for improvement, and you suddenly understand the value of that theory and knowledge and what that actually means in terms of outcomes, and it can be done. What inspires me, if I was to be honest about my fossil knowledge, is Deming. So Deming inspires me in terms of his thinking and how he applied his knowledge and how that transformed people, which then transformed organizations and systems. And that's now true in healthcare as it is anywhere else. What inspires me about the NHS? I guess the one thing that really inspires me about the NHS is that it is a reflection of this country's sense of justice and equality. So it's a universal system of healthcare that aims to treat people regardless of where they sit in society. And that inspires me phenomenally. And I really want that to continue. And for that to continue, we have to improve its ability to deliver high quality care. In terms of what I think is perhaps troubling about the NHS or could be improved in the NHS, is to perhaps stop thinking that we can continue to restructure to deliver better outcomes. I think that actually investing in the people to fill that gap of how to improve will allow us to deliver phenomenal leapfrog changes in the quality of care for the people of this country.